All right, thank you for attending today. My name is Wade Meyer with Highmark, and we're going to talk about the benefits that are available to you as city employees. And now we have several different groups that might be on the call here today, so we won't be able to get into specific numbers such as a copay or deductible. That depends on what plan you pick, depends on perhaps what you do for the city. But there are many commonalities, and quite frankly, the main differences from what we're going to talk about are just that: what your copay is, out of pocket cost might be, and again, depending on what plan that you pick. So let's start with the network itself. The plans that you have available through Highmark use the PPO Blue network. So when you're looking on the Highmark website or looking for providers, you want to go with PPO Blue. PPO Blue is our largest network. It contains providers throughout the state, the region, and even across the globe. We'll talk more about that as we move through it. It includes the entire Allegheny Health Network, and it includes the entire UPMC Health Network as well, in addition to countless other private physicians and local community hospitals are all part of that network. That equates to, just in Western Pennsylvania alone, more than 11,400 primary care physicians, specialists, ancillary providers. 2,800 of those are part of the Allegheny Health Network. More than 100 urgent care retail clinics and more than 50 local community hospitals, emergency rooms, and other health systems. But as I said, the entire UPMC health system is part of the network. That includes the McGee Women's Health Center, Western Psych, Children's Hospital, and the other hospitals that you become accustomed to using. And of course, the doctors that are employed by UPMC and practice out of those facilities. The Allegheny Health Network has health pavilions that are opening up throughout the region to give you a wide array of outpatient services all under one roof, as well as micro or neighborhood hospitals. We have 4 of them currently operating in various communities such as Brentwood, Harmer, McCandless, Hempfield. These are community hospitals that are containing 10 to 12 inpatient beds, but are geared towards more outpatient services such as diagnostic care, specialist care, emergency room care. Many of the services that we have rendered that we need are done in outpatient settings. So we're finding that smaller micro hospitals tend to work well in many areas. But of course, you've got the full backing of the Allegheny Health Network and the other hospitals if you need more elaborate care that isn't performed at one of those. And then, of course, urgent care centers and the investment that Allegheny Health Network and Highmark has provided into Western Pennsylvania over the years since that particular partnership became apparent or became into fruition. A couple accolades from CareCheck for the Allegheny Health Network. Jefferson Hospital is #1 hospital in Southwest PA for medical excellence in neurological care and bariatrics. Allegheny General is rated #1 in Southwestern Pennsylvania for medical excellence in major cardiac surgery and liver transplants. West Penn Hospital, #1 in Southwest PA for medical excellence in cancer care, and among the top 100 in the nation for medical excellence in women's health. So regardless of what provider you might be using, where you may be having your care, you're going to have access to, again, those 2 major health systems and other community hospitals throughout the region, such as St. Clair, Heritage Valley, the Washington Health System, etc. If you wanted to put a number on the network nationwide, you have access to just not the hospitals here in Western Pennsylvania and the doctors here in Western Pennsylvania, but throughout the country. 1.7 million doctors and hospitals are part of the PPO Blue Cross Blue Shield PPO network. That translates into about 95% of all hospitals. You also have coverage when you're traveling abroad out of the country. There is a network in 190 countries that you can get the access that you need through the Blue Cross Blue Shield Global Core program. And when it comes to emergencies, you're covered at any emergency room anywhere on the planet for whatever reason, regardless of whether that hospital happens to be in network or not. And then finally, you have access to thousands of Blue Distinction Centers for Specialty Care throughout the U.S. These are hospitals and providers that have achieved high accolades from the Blue Cross Blue Shield Association in their treatment of complex conditions such as transplants, bariatric services, etc. It's kind of like the cream of the crop, if you will. So you got access locally, nationally, and throughout the planet if you need it. So a couple other features that are available or that are across the board, regardless again which plan you might pick or what you might do for the city, includes mail order benefits. Under your prescription plan, you can get mail order medications, rather, I should say, through mail order. You can get up to a 90-day supply of an eligible maintenance medication, and in comparison to getting that same amount over time through your local pharmacy, you'll find that your copay or out-of-pocket cost or your percentage, again, depending on what plan you're on, is a fraction of the cost for sticking at the retail pharmacy. Now, you can start using your mail order benefits if you're enrolled in the Highmark plan. Very simply, there's several avenues that you can explore. The simplest thing to do is to talk with your ordering physician. Your physician very well may be able to communicate with our mail order pharmacy, Express Scripts, that's who we use, directly through their e-prescribe software, and that's the simplest way to do it. You can also get on the Highmark website where you can navigate to the pharmacy benefit pages, and if you already have a prescription on file with Highmark, you can follow the steps to request that transferred over to Express Scripts for mail order. Give our member service line a call. We can reach out to your physician or help guide you through how to get that transferred over. And then there still is the old-fashioned way of downloading a order form and filling it out and sending a receipt in to the mail order pharmacy address through Express Scripts. But again, the simplest way, reach out to your physician. Next, jump on the Highmark website or give us a call and we can walk you through switching on over. You will save time. Mail order comes right to your home, and also financially with that difference in copay structure. Under the Highmark plans, you have a robust preventive benefit. Services that are performed in accordance with the Highmark preventive schedule are covered in network at 100% with no cost share. When you pay a copay or you have a deductible or you pay a percentage, we call that co-share. The Highmark plans cover preventive services at 100%, meaning no cost to you for that service. The preventive schedule is based off of the U.S. Preventive Task Force lists A and B. And there is a difference between a preventive service and a diagnostic service when it comes down to the way that the claim or the request for payment is sent in, and consequently the way that it is processed through. Preventive care is when you're symptom-free. You don't have any issues or problems, no underlying condition that's being monitored, etc. You're just symptom-free. You're going in, having the test or the visit done based on those guidelines. Again, the U.S. Preventive Task Force list A and B, age, gender appropriate items and services that we should be having done based on those recommendations. Those are the services that are covered at the 100% level. On the other side of the coin, if you're having services because of a risk factor or because of an ongoing problem or an underlying medical condition that's being monitored, those, when they are sent into the insurance carriers, are designated or listed as diagnostic care because there's a problem that initiated the visit. It's not just simply based on those preventive task force suggestions. Diagnostic services, again, depending on what plan you're on, you may have a copay, may have a deductible, may have a percentage. But again, the point of this slide, services that are performed in network in accordance with the Highmark preventive schedule are covered at the 100% level. And you're able to see that Highmark schedule on the Highmark website, as well as if there's any open enrollment material that is provided, you can take a look at that as well. Highmark also offers a variety of other programs and resources for you. Again, no matter what plan you enroll in, no matter what your options are, you'll have access to the following couple of programs I'm going to highlight for you. One of them is a diabetic prevention program. A diabetic prevention program is designed for members who are at risk for diabetes. The term is used pre-diabetic. With the diabetic prevention program, it's free of charge to you to participate in if you meet those qualifications of being pre-diabetic, not having a previous diabetes diagnosis. There's a small questionnaire on the Highmark website that you can fill out to see if you qualify for it. And you can participate in the program through one of two means. There are some local YMCAs that offer in-person programs, and there's also an online program that runs about 52 to 54 weeks that you can participate in to help reverse those trends. Diabetes is not curable. If your situation has progressed into diabetic type 2, you're going to be a diabetic type 2 for the rest of the go. However, pre-diabetes in many cases can be reversible based on behavior changes, diet controlling exercise and diet. And this program is designed to help you turn that situation around before it does become a full diagnosis of diabetes. Yet another program that's available to you is Well 360 Virtual Health. You can have consults through the Highmark Well 360 Virtual Health benefit 24 hours a day, 7 days a week with board certified licensed physicians who are able to diagnose many of the common non-emergency but somewhat urgent circumstances that we face, whether it's pink eye, sinus infection, strep throat, mild COVID symptoms, the flu. I like to think of this resource as being there when you know what's wrong with you and you need a doctor to confirm it, and then more importantly, call in a prescription on your behalf. Because the providers are board certified and licensed, they can call a script in on your behalf and diagnose many of those non-urgent conditions right there over the virtual consult. You can access Well 360 Virtual Health through our new Highmark website, the new platform, myhighmark.com. You'll hear more about that before we conclude today, or the accompanying mobile app, My Highmark app. And just like we're doing here today, having a virtual presentation or virtual meeting, it's the same when it comes to having the consults through your smartphone, linking through that app or online, video camera, microphone, etc. You also can have therapy services for conditions such as anxiety, depression, insomnia, and even scheduled psychiatric assessments to help with prescription refills and treatment options. And when it comes to the comparison in cost between an urgent care visit or an emergency room visit, the Well 360 Virtual Health benefit is going to be much less expensive than those other two options. And again, depending on what plan you go with, the copay or deductible or percentage. When it comes to behavioral health services, Highmark has a variety of avenues and resources for you and your covered dependents. When it comes to good mental health, a good place to start is having a trusted primary care physician. Primary care physician can help answer questions, guide you to the right care, be a gatekeeper, and keep track of your ongoing treatments and conditions, and kind of be that hub and that central part. If you need help finding a primary care physician, you can go on our Highmark website, give us a call, and we can help find someone for you, maybe even take some steps to help set up an appointment on your behalf. Also, you can schedule again those services through the Well 360 virtual health team that we had on the previous page. The Blues on Call nurses are available for you. They are a nurse hotline available 24 hours a day, 7 days a week to help you with care decisions. And that telephone number is printed on the back of your health insurance card along with the member service number and those website addresses. And then we also have health coaches that can help you telephonically manage stress, anxiety, get better sleep, even go into helping with chronic conditions such as dealing with diabetes or asthma or just getting more physically fit. So the health coaches go well beyond even just the mental health concerns that we're talking about here on this particular page. In addition to the services that the health coaches can help with, they can also help you quit smoking, looking to lose weight, or again, go through helping you with things such as insomnia and diabetic concerns, or just getting more physically fit. And you can see here, as I mentioned on the previous slide, a couple of those conditions like asthma, diabetes, heart disease, etc. On our Highmark website, you have access to the Blue 365 discount program. This is a program that is sponsored by the Blue Cross Blue Shield Association that partners with various online retailers to offer discounts on health and wellness related items to Highmark members. We called one of them out on the screen, the Fitness Your Way by Taviti Health. This is a program that gives you access to all of the fitness centers and gyms that participate in the program for one low monthly fee each month. Right now, the number's up to over 9,500 fitness locations throughout the United States. And it's almost as if you have 9,000 memberships in your back pocket. You can go to any one of those providers for that low monthly fee, that low enrollment fee, and use them as if you were actually registered with them directly. Some other discounts I've seen out there, I've seen Everlast offering discounts on home workout equipment. I've seen supplements, minerals, vitamins, etc., having discounts online. I've seen acupuncturists and other alternative providers of care giving discounts to Highmark members. Discounts on hearing aids or even LASIK eye surgery are available. I even at one point saw a couple hotel chains that were offering discounts to Blue Cross Blue Shield members. So you can access that directly through the Highmark website or directly through blue365discounts.com. In addition to getting on the Highmark website, we encourage you to download the mobile app and that new My Highmark mobile app, to be precise. That is going to give you all of the access you need all in one place. I'm able to look up your claims, look up your covered dependents, get identification cards, check on any health and wellness resources that are available out there to you. And of course, you can always reach out to member service if you prefer to speak to somebody directly. When you're looking up doctors and hospitals, use that Highmark website. Now, although my slide here says why have a PCP, I want to make sure that you understand that your plan does not require that you pick up a primary care physician, but that lack of a requirement doesn't negate the importance of having a primary care physician. In other words, just because your plan doesn't require it, that doesn't mean it's still not important to do. And I alluded to that earlier when I was talking about the behavioral health resources. So your family doctor, in addition to the behavioral health services, can help with preventive vaccines, physical exams, health screenings, and again, guiding your care. These instructions will not only help you find a family doctor, but any doctor. So as I said when we started, 1.7 million doctors and hospitals are part of your plan. When you go to the Highmark website, following the instructions on the screen, make sure you select PPO Blue. Highmark has a variety of different networks, and yours is the most robust. So make sure you pick PPO Blue when you are looking up doctors and hospitals. Now, where you have your services renders have a direct impact on what your cost will be. You have co-pays for certain things, you have deductibles for certain things, maybe a percentage for certain things. And again, depending on what you do for the city or what plan you pick will dictate what those numbers might be. But even just within that scope, different providers, different service sites have different rates depending on what that contract is between insurance carriers and that provider. And even within that setting, you might have a difference in cost between providers. Kind of an example would be if you are having some mild, let's say some mild flu symptoms, you've got a variety of resources that you can explore to get care. You can call the telemedicine team. You can go to your family doctor, go to the urgent care, go to the emergency room. You're going to get treated the same way in all of those settings, and you're going to feel better in a couple of days. But your difference in cost could be a small copay for the virtual visit to maybe several hundreds or maybe thousands of dollars at the emergency room. You had the same problem, the doctors treated you the same way, but your cost was significantly different between the three or four options. Now, don't get me wrong. I'm not saying to avoid the emergency room at all costs. I'm saying use the appropriate site of care. If it's a life or death situation, go to the emergency room. If it's something that the urgent care center needs to do, like maybe a small cut that needs stitches, you can't do that virtually, at least not yet. Go to the urgent care center. If it's something that a physician can help diagnose online through the virtual care, utilize that. When you're using medications, seek out and use generic medications. Of course, consult with your physician about your options and alternatives. And a rule of thumb, generics have the same active ingredients as their brand counterparts, but can be significantly less in cost, whether it's a smaller copay or a smaller percentage. And Highmark has tools on the website that can help you make those decisions through our care cost estimator, where you're able to put in a particular condition, take a look at what the cost might be at different providers and see in real time based on where you are in your different cost shares and whatever plan you might be in and what that might translate to when it comes down to the actual cost for you. So reach out, use the tools that we have, get the care that you need. That is always quintessential, but at the right place of service. And as I said, whenever I kind of rolled out the Highmark website, we have a new platform, My Highmark. You can be accessed through myhighmark.com or download the My Highmark app. The platform is similar in appearance between the website and the app. So if you are a preferred app user, but for some reason have to get online or vice versa, you won't be fumbling around trying to navigate because they're very similar to one another. The new app experience comes up to speed with what we're used to whenever we use other mobile apps that we have at our disposal. You're able to see your identification cards, manage your cost, check your claims, explore programs, and take advantage of that new platform. Now, if you have your smartphone handy and you want to scan the code, feel free. That will open up right into your Apple Store or the Google Play, and you can download the My Highmark app immediately, or of course, you can just search for it. The app has been structured, the app and the new website has been structured to work with the same credentials that you're using right now. So whatever username you have and whatever password you have on the current Highmark website is the same for the new My Highmark app and website. It is a soft launch, and both platforms are existing simultaneously for some time. But over the course of the next several months and into 2024 and beyond, we will be phasing out the old website in favor of the new one, and there'll be kind of some soft reminders and some launches and some hard directs right over to that particular URL as we move through. But I'd encourage you to start using that resource now because it's a really improvement to what we're used to and a great resource for you. And then finally, as I start to wrap up, I just want to highlight a few other resources that you have if you enroll in the Highmark plan. Again, talking about some community resources, Highmark works with the different entities out there that help us when it comes down to needing help with things like financial assistance, housing, food pantries, transportation, personal safety. And you can find that information through highmark.findhelp.com. Incidentally, that's a public address, so even if you don't enroll in the Highmark plan, if you or family members need help with those day-to-day living concerns and items, jump on that website. We've compiled all of those lists for you into one easy to find listing or website. Whole Health Living is another discount program with the largest alternative medicine network in the nation. Again, as a Blue Cross Blue Shield member, just get on there. You can take advantage of the discounts that Whole Health Living offers for you. And then we also took some time to put two very important telephone numbers up on the screen, which of course, when you get the recording, will be available to you as well. The Suicide Prevention Lifeline and the National Domestic Violence Hotline. Keep those numbers handy. I hope you never have to use them, but if you or a family member or someone that you know is in crisis, reach out for help. There are people out there, just not here within Highmark, but throughout the nation that want to help and get you the care that you need. Yet a couple other resources for you and your covered dependents. The NOCD services offer treatment for obsessive compulsive disorders for members that are 5 years and older. And again, telephone number, website will be posted for you when you get the recording. We'll talk a little bit more about the Spring Health program that's available if you enroll in the Highmark plan. But just a quick synopsis, you can schedule care for a wide array of mental health conditions through the Highmark Mental Health Wellbeing that's being powered by the Spring Health. June offers therapy and digital tools to meet the unique needs of teens and young adults age 13 to 24. And FreeSpire is a digital tool that helps members age 18 and older learn techniques to reduce or eliminate symptoms of panic disorder and panic attacks, as well as post-traumatic stress disorder. And again, the numbers will be provided to you once the recording has been finalized. Bright Heart Health offers treatment for mental health, eating disorder, substance use disorder, including alcohol and opioid use for members 18 and over. RIA Health offers treatment for alcohol and alcohol use disorders, again, members 18 and over. And Wayspring offers peer-centered approach to treating substance abuse disorders. And MAP Care Solutions is a peer recovery program with digital support for members age 13 and older who have mental health and substance use disorder. So as I finish up here, I just want to talk a little bit more about the Spring Health, our mental well-being solution that Spring Health is powering. This is going to be available to Highmark members that enroll in the plan age 6 and over, beginning 2024, so here in a few short months. And the reason for it is that 1 in 5 Americans are going to experience mental health issues and concerns each year. That's according to the CDC. And with the demand for behavioral health care services growing exponentially, it's hard to get in to see a provider. So Highmark is focusing on making sure members are connected to the most appropriate care based on their needs. And this program is designed to do that. It increases network access, both virtually and in person, to a broad range of evidence-based resources for individuals that have a high behavioral health acuity need, making it simple to get through the care that you need or to get the care that you need through our digital app experience. And the providers are able to help with a multitude of behavioral health conditions that members might have. Getting registered is very simple through the My Highmark mobile app or the My Highmark website. You can access the benefits and the get help and or the, excuse me, the get care sections to access the Spring Health team. Simply follow the instructions on the screen. Uh, it starts with a screening, a digital assessment that pinpoints the immediate need of the member as well as long-term goals, matches the member with a personalized care plan, gets them access to licensed clinicians whenever necessary, and gives them access to options that are available to them, not just through that tool, but through other resources that are out there for members that find themselves in need of behavioral health services. And then finally, some resources for you to reach out should you have questions about the plan, about the network. If you have questions about a claim or about other programs or resources that we talked about, we have the enrollment hotline with a reference number that will identify you in our system as the City of Pittsburgh employees. And then, of course, the general member service number that's available to you once you're enrolled 8 a.m. to 8 p.m. and our Highmark current website, as well as the new My Highmark website that we spoke about earlier. And then finally, just a couple other resources that we did not have a chance to talk about. We'll have displayed on the recording, such as the My Care Navigator team, the Baby Blueprints program, which is a maternity education program for moms to be that have questions and concerns and support resources. We mentioned the Blue 365 program when we talked about the discounts. But again, these will be available to you in the recording, so you can pause that recording when needs be if you do need to reach out and access one of these resources. So I thank you for your time today. I will pause there and turn it back over to your human resources team for any closing comments and or any questions.
Hi, wait, we actually do have a question in the chat. I believe that it says that the connection, when trying to download the app, it says the connection is not private. Can you clarify that?
Sure, let me pull up the chat here and take a look.
Okay.
That's a very interesting error that came up. I say that because I ran into a similar situation this morning. Over the last couple of days, actually, my app kind of stopped working for me, and I was getting hung up at a particular on a particular page. It just didn't load for me. And now I don't know that this is the exact circumstance here, but what happened with me was I have Wi-Fi, set up at my house, as many of us do, and I've got the pods that you plug into the wall. And I'm not an IT guy, so I'm not sure what they're called, but they basically boost the signal all over my property and so forth. Well, there was an update done to that system, unbeknownst to me. That's part of the enrollment, part of the what I pay for, so to speak. But here it toughened up the security settings on that system and was identifying the My Highmark app as a potential spam or potential cyber criminal site for trying to get my information. So I had to go in and basically enter the My Highmark website as a legitimate, safe website. So the error that I see popping up on there doesn't necessarily surprise me simply because I ran into a very similar situation this morning. As long as you're going to myhighmark.com, then it is a legitimate site. It is the site we're using. Your security settings might be set very stringent, and something within that site is hitting. Because remember, that site enables you to get into a lot of personal information. And with the cyber safety that we have out there, servers and browsers and internet providers are being very, very cautious. So I would take a look, see what your settings are. The accounts.myhighmark.com is routing you to the proper place. That what gets you into the username and password, so you are on the right track.
Okay, thank you.
You're welcome.
And we only had one other question in the chat, and that was just pertaining to UPMC, just double checking to make sure that UPMC is in network with Highmark.
And that is correct. Yep.
So if anybody doesn't have any more questions, I will stop the recording.